Welcome everybody to our Future Focus webinar. I'm delighted to see you, and we've got some great speakers today. So I want to introduce to you Jemima Reynolds, who is from Tredstock, and I'm sure she'll introduce you herself to you and tell you all about her organisation as well. So Jemima, you go ahead, and we'll do some questions towards the end.
Thank you very much for having me to speak today on what matters to young people. My name is Jemima Reynolds. I'm the head of programs at Tredstock, and Tredstock is a charity that supports those in their 20s and 30s. 34 young adults are diagnosed with cancer every day in the UK, and we're here to provide a community to those in their 20s or 30s who've been diagnosed with cancer through informative events, expert advice and physical activity support designed to keep them active during or beyond treatment. Why another charity? Why is it important to support 20s and 30s? It's such an important stage of life. We support those just diagnosed in treatment, post-treatment, late effects and benign tumours, borderline ovarian, MDS and aplastic anemia. But the question today is what matters to me? What matters to young people when diagnosed with cancer and living with the effects? So, my question to you today is going to turn it on a head. What matters to you? I can't see your lovely faces, but in your 20s and 30s, what matter to you, or what's mattering to you? Is life about your friendships? Is it about keeping active? Is it about dating, getting married, meeting a life partner? Is it about enjoying a good sex life? Is it about traveling? Is it about the possibility of having children? Starting a new job, saving for the future? And all of this gets stopped in its tracks when you're diagnosed with cancer. Your life goes from being independent to being dependent on the medical team. And no longer can you go to a festival. Instead, you're having to cope with fatigue or interactions of drugs with alcohol. Being unable to keep up with your friends, being unable to meet the milestones that they are. Getting active is hard enough, let alone with cancer. Not being able to navigate work because they don't understand your needs, or you're coping with fatigue. Travel insurance, sex with a dry vagina, low libido. Dating, how do you tell someone that you've had cancer, that you may not be able to have children, that sex may be painful? All of these things are such an important part of life for young people. Tredstock supports through this time has been invaluable, from their online support groups, which allow us to connect with others, their online fitness videos and exercise programs, keeping us moving, and Tredstock's team being there to support and guide us. Emotionally, it's really tough at the moment, but having these stepping stones to keep our lives as normal as possible has meant so much to me. So what does matter to young people? What does the research say? What do people tell us? So 71% tell us they want emotional support, 62% physical activity, and 55% nutrition and food. And that's all across the cancer pathway. Life after cancer treatment is a strange place at times. It's like rejoining the world, but living somebody else's life. So what I want to say today is, what about across the cancer pathway do the needs change? So just diagnosed, to be expected, they want support with mental health, meeting others, nutrition, physical activity, sex and relationships, and friendship support, and fertility, and menopause. On treatment, what's the most important thing that they tell us is their mental health support. Meeting others is really up there, but so is physical activity, so is nutrition, so is helping people navigate friendship. Up to 2 years post-treatment. So what have we got? We've got still people struggling with mental health, but the physical activity is a second support need of young people at this time. They also really want to meet other people who understand. And nutrition is up there as well, showing just how important it is to eat well and to be able to support their bodies through and with cancer. What about 2 years post-treatment? So they're still struggling with their mental health, and they really want support with physical activity and meeting others, and fertility issues. But really interesting, what about incurable cancer? This is really interesting to me, that they still want physical activity support. They want to be able to get active safely because it helps your mental health. Nutrition is really important, and so is meeting others. At Trekstock, we know that you guys are doing an amazing job to help people survive cancer. More targeted treatments, more people are living longer with and beyond cancer, but at what cost to their physical and mental health, and most importantly, quality of life. One young person put it, "What's the point of me surviving if my quality of life is so shit?" Life as you know it is stopped in its tracks. And young people tell us they feel so isolated. This image is a young guy waiting to be seen, but look who he's surrounded by. He's sort of isolated from his peers. He's often the youngest person on the ward and at support groups by at least 20 years. I couldn't relate to others talking about early retirement and their grandkids. When I discovered Trekstock, a year out of treatment, I felt like everything I was feeling made sense, and I finally found a community. As we've seen right across the cancer pathway, people want to meet others who get them, who understand what life is like. There's moments, why is Trekstock called Trekstock? It's not because of this reason, but one young person told us cancer's like going on a trek, and there's moments in it where you have to take stock of your life. There are questions, 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 and some questions are answered really well, and some questions aren't asked, or the young person finds it hard to bring them up. So what do? We tackle social isolation. We equip them with practical tools to improve their quality of life during and beyond their treatment. We give them a backpack to navigate the journey, and we help them find a way through by navigating this new terrain with others who get it too. They still want to have fun, they still want to meet people, they still want to keep active, they still want to eat healthily, they still want to be able to understand the options when it comes to having children, and they still want to have sex. It's the mental challenge far greater. After I finished treatment, I expected life to go back to normal, but the reality is much harder. I felt fearful of my future, isolated and unsure how to move on. Trekstock helped me connect with others who understood what I was going through. I enjoyed going to their meetups and having fun activities. We operate under 5 pillars. I'm not going to go into the exact mechanisms of each one, but be active, get connected, be equipped, be present, and be empowered. So I know, having talked to Elaine, that you guys have talked about physical activity before, but this is a quote from the Australian Oncology Society that says, if the effects of exercise could be encapsulated in a pill, it would be prescribed to every cancer patient worldwide and viewed as a major breakthrough in cancer treatment. But we know that young people are telling us that healthcare professionals aren't talking to them about it. And young people don't know what to be asking. They want, as we've seen right across the cancer pathway, they want support to do so. Why do they want support? More and more research is coming out. It reduces recurrence by 40% in some types of cancer, bowel, prostate, and breast, and more research is coming out. It's the one thing that combats cancer-related fatigue, both during treatment and for many years post, improves mental health and quality of life. It reduces the effects of cancer treatments, and it helps people to gain confidence in what their body can do and not what it's been through. I don't know about you, but these cold winter days, getting active is really, really hard. I did it this morning. I'm proud of myself getting out of bed, but trying it with cancer. So we bring young people together to get active together, both in treatment and post-treatment, in small groups, online and in person, run by level 4 cancer rehab trainers. One person said this, it makes you feel really good. It makes you feel beautiful, especially after your hair falls out. It makes you feel stronger. It makes me feel like I can get through the rest of the treatment plan. I look forward to it every week, and it's really helpful to work with someone one-to-one because they're helping me to support myself to move forward at my own pace. You don't need me to tell this, but the research shows all of that, the impact of getting physically active when living with and beyond cancer. So young people are saying they're not taught to about it, and healthcare professionals are telling us that they don't know how to bring it up. So don't use the word exercise. They don't want to hear that. They want to understand how it can help them. Tell them about that it can reduce their recurrence, that it can also help their mental health. It can connect with their friends again. It can help them trust their body again and feel more in control. They want you guys to bring it up. They don't want the onus to be on themselves to bring it up. They want to understand what they can do to help themselves. What about if they tell you that they're too tired? What about suggesting the 10-minute rule of doing something they enjoy that gets the heart rate up? And if they don't feel right, then stop. But if they do, just keep moving. They're scared of getting hurt. So our Renew program is really effective because it's run by experts for young people with cancer. As you can see, that people want to meet each other, and no more so since COVID. We've seen that now 83% of people want support meeting others. We do that because it helps people reclaim their sense of self and to see life beyond a cancer diagnosis and gives people hope. It's so nice to be surrounded by so many young adults who have experienced cancer, but it didn't feel like a cancer event. It felt fun and something I'd attend. We equip people with information. I mean, the word sex is radiating from that screen. We know that it's something that healthcare professionals aren't talking about, but sex is a really important part of life, and young people need to be helped to be able to do so and to be able to know what they can do to get back in touch with their bodies, to be able to have intimacy again with their partners, but also to be able to get back in touch with themselves so they feel able to do that if they want to. We lift the lid on work. So young people are saying that they didn't know that the Equality Act covers them for life. They didn't know that they could ask for reduced hours and how to have those conversations. So we look at the practical ways through our panel events. We did an event on living with incurable cancer. People tell us they want to hear stories where you can live life despite the effects of cancer. What about fatigue? 9 out of 10 people are coping with fatigue. And we know this, but what about the solutions? Exercise is such a key one. Mental health support, meeting others, nutrition. All of those things are really, really important to help people to take control and to self-manage the effects of cancer. This is just guys, we brought guys together to talk about mental health, and they said there was no awkwardness and it was really fun. Young people came together to talk about living with cancer, incurable cancer, while still being real about the absolute shit show of living with cancer. It was heartfelt, informative, and positive. What about friendship? People say to us that they really struggled at the fact friendships fall apart. And this person said, I've just presumed that my friends understood and felt comfortable with it all. Hearing everything the panelists said encouraged me to have open conversations. We're doing so well with stage 4 cancer. It was really nice to hear that everyone has bad days, even years after treatment, and it's okay. We also know that the most important people to hear from is young people themselves. So we have events where we get young people to tell what they wish they'd known. As you can see in this image, passing the baton back to empower people to live their best lives. One of the things that young people tell us is very much not talked about is early menopause. 40% of people who go through cancer experience early menopause, temporary menopause, or surgical menopause. And we know that people are not talked about it or being referred to menopause specialists, and most importantly, empowered to be able to navigate their menopause. So we bring together experts on a 5-week program that was designed by Danny Binnington and myself, she had breast cancer herself in her 30s and had a surgical menopause due to being BRCA. And we have Dr. Anis Mukherjee talking about the non-hormonal options that are medical, about lifestyle, about nutrition. We support people to have the conversation with their GPs. We help people to understand about their sex life, vaginal estrogen. There are people on the program who haven't being supported to have HRT, even when they can, from stem cell transplants to bowel cancer to sarcoma. So we know that one of the things young people want to be told is not that they're going to go through early menopause, which is important to talk to them about, but what can they do about it? They want to be empowered and they want to be able to be equipped with the right information, but most of all, to be less scared about the long-term health. So we talk about exercise and the importance of that for your bone health, your cardiovascular health. 83% said very like to recommend the program. 83% a lot clearer about their options, and 67% felt a lot less isolated. What do people tell us? They said 61% had never talked to another young person about it. 48% said it made them feel a lot more lonely. And 48% said oncology team at diagnosis didn't bring up the menopause. I wish I had access to all this information at the very start of my menopause journey. I can't believe this guidance and education isn't provided by the NHS to young adults with cancer, and we're left to seek it out ourselves. Our food and cancer booklet. I'm sure you hear time and time again people saying, I'm going to go vegan, I'm not going to eat dairy, I'm not going to eat meat. Where are these myths coming from? People are doing them, so we need, cutting out things. So we wanted to create a booklet where we talk about the myths and where the pseudoscience comes from, so people understand and can make informed decisions around. And we also look at ways to support them during treatment with weight loss, weight gain, but doing it in a healthy way. So talking about how to put on weight healthily through different ways. We talk about tips and tricks with nausea and mucositis. And all of this information is done by an oncologist, 2 dietitians, and 3 young people who have had cancer themselves. So we're really passionate about ensuring that we make impact, that we are impacting people's lives. So that's a little bit about the impact that we have on people. What are we massively about? We're massively about helping people graduate from Trek stock, helping them get back on their feet so they can live the life and not be kept in a cancer bubble. Thank you very, very much for the opportunity to speak today.
Thank you so much, Jemima. My goodness, that is full of information for us to consider and think about in practice. Thank you so much for joining us today. Karen is a service improvement advisor at the Royal Free Hospital, and she's going to change tack a little bit and talk about what matters to staff. So please do, Karen, take it away.
Great. Thank you, and thank you for the introduction. Yeah, it's a bit ET-esque, isn't it, with the bike here? So I'm not distracting anybody. Yeah, so hello, my name's Karen Turner. I'm a senior improvement advisor at the Royal Free Hospital. I've been doing that for 3 years. Before that, I've basically spent most of my life working in cancer care, palliative care. I worked at the Royal Free and led their therapy service there, and a Marie Curie hospice in Hampstead. And actually I did my MSc at the Marsden. So it was really, really nice to be here today. And so much of, Jemima, what you said really resonated with me, sort of both personally with friends I've known and in the work that I've done. So thank you for raising some really, really important issues. I think it's really, really important that we talk about these things and highlight them. And I think that is something really important about what matters. So I'm going to just give you a very quick whistle-stop tour. I've done loads of what matters to you. My team joke all the time that if ever you want to call with me, you'll always hear me talk about what matters. They play what matters bingo. I'm an absolute passionate advocate for asking patients what matters. We at the Royal Free, we now have a patient what matters to you committee and a staff what matters to you committee. It's totally becoming the DNA of the organisation. Because you cannot guess what matters to someone else, as Jemima was saying. So often you have those things that matter to you that unless you are given the opportunity to be able to say what matters, and you have someone who's really curious and wants to find out. So often that we miss in healthcare. It's like I often describe it with 2 magnets, that to north or south together, and you just don't quite mix. And yet when you turn it around, and you can actually have a connection when you ask what matters to you. So got loads of data from 5 years of being totally obsessed with what matters to you about patients, but I said I'm going to be here to talk today about what matters to staff, which is what I've been doing a lot of recently. So I'm going to share my screen and try and share my slides. Here we go, and I'm going to try and do this. Let's hope it works. Can you see my screen? Amazing. My internet is poor. I'm ready with my phone in case I have to switch over. So I'm going to talk about now what matters to staff. So just very quickly about my What Matters to You journey. So I was a Florence Nightingale Scholar. I don't know how a physio got to do that, but here we go, there we go. I went to a forum, the Institute for Healthcare Improvement International Forum, where I heard about What Matters to You for the first time. And I was also learning about the model for improvement at the same time. So I was learning about improvement and what matters to you. And I was a jobbing 2-day-a-week physio, working 2-day-a-week, 2 sites, and sort of felt very sort of out of place, I have to say, when I went here, sat in a big room with 5,000 people, listening to different people talk about things. But the thing that I came away with, wow, was the importance of asking what matters, because it was presented there for the first time to me. I'd never heard it before. And we were 5 weeks away before our What Matters to You Day. And if anyone, I'm sure you all know, but every year there's a What Matters to You Day. It's either the 6th or the 9th of June. Next year it'll be the 6th of June, I think, again, where it's a really good opportunity, if you haven't asked What Matters to You question before, to do it and to try it and to test it. And that's exactly what I went back and did. And we had a What Matters to You Day. We've had 5, as I say, What Matters to You days. We've had 6 so far now, since then, which just helps raise the profile of asking the question, what matters to you? And it's, as you all know, it's all about, rather than just finding out what's the matter with someone, it's finding out what really matters to them. And so we've done this with patients. I've did a really big piece of work in the hospice that I was working at, and just quite radically transform some care. And help people think about really what we were doing. No one goes into healthcare to do a bad job. We're all trying to do our best. But actually, after 20 years of being a physio, I thought, oh my goodness, I wish I'd learned this at the very beginning of my career, because I thought I'd been doing patient-centered care the whole time, because I felt I was, pretty not bad at what I was doing, and I really cared and I really did my best. But what I was basically doing is going up to people and asking them about what mattered to me, really, about them. So whether it was their walking, their standing, their stairs, their muscles, the pain, how to get home. And I wasn't really asking what really mattered. And I started those questions. Wow, I mean, the stories I could tell you about the transformed care from just asking that. So I'm a total passionate advocate of asking what matters. And I sat on the international committee. I'm literally like crazy about it, because I think it is it's really, really important. But I'm here to talk to you about staff. And the usefulness of asking what matters to you to staff, to each other, to our friends, to our families, to our neighbours. And it's all about that connection. And it's just a brilliant question to if we're trying to make connections with people, and we need to do that and to look after ourselves and our colleagues as well as our patients. I shouldn't say our, sorry, as well as patients that we serve. So you may or may not have seen this. So the Institute for Healthcare Improvement, it was quite a long time ago now, 2017, same year, wrote a white paper. And if you are interested in staff wellbeing, it's really worth a read. It's written by a lady called Jessica Perlow, and she had collected a whole load of data about how you could, about what mattered to staff, the sort of things that would bring someone joy in their work. And it started off with asking what matters, and then identifying the pebbles in their shoes. So asking what matters, pebbles in your shoes, i.e. the things that are annoying you, the things that aren't going so well. And then thinking about how you make joy in work and leadership, commitment, and then using the model for improvement or improvement science to test your approach. And she said, if we do that, then you're going to have improved patient experience, organizational performance, and reduced staff burnout. And this was I'd just become an improvement coach in my organization. I was still a physio, and so we started a really big project. I haven't got any slides about it, but looking at reducing the turnover in intensive care. I didn't know anything about intensive care. I've done a few scary weekend shifts, but didn't know very much about it. But I did know that actually I did learn on this project the importance of asking what matters. And we reduced the turnover in this intensive care unit from 48% to 25%. That was our aim. Then it went down to 18%, and today it's 9% by asking staff what matters. And the culture in that intensive care unit is totally and utterly changed beyond recognition. It's just amazing. But this is what we built on our this sort of framework of asking staff what matters, and then getting on and doing it. Because the important thing to remember when you're asking staff or patients is not just asking what matters, but listening and doing what matters too. You have those three components. You have to do those three things. If you ask what matters and then don't do anything about it, or don't look like you're listening, then that's worse than not doing anything at all. And sometimes a conversation is the doing. You don't have to. I think as physios, we feel very much like we have to physically do something, and I certainly do. And we don't always have to physically do so. Sometimes it's the listening and it's the understanding. I've certainly had people tell me things that matter to them about them dying, or about things that I couldn't do anything about. But it was, I think, yeah, listening and talking is an intervention in itself. So I'm a passionate believer in asking this. So I basically set up a program in my organisation. I've got quite a supportive boss who just lets me almost do whatever I think is the right thing to do within reason. So I set up a big program thinking about how we really operationalise asking what matters for staff. So we basically, it's the purpose of this program is that we can qualitatively and quantitatively measure staff satisfaction on our site priorities, on things that matter to the organisation. I've got this chief exec talking about what matters to him, finding out what matters to him, what his priorities are, and then aligning how we then measure that across the organisation. So we sort of designed this sort of systematic approach to within MDTs to listen to teams about what matters to them. We're really involving leaders in this whole process, because what you realise is that you need to, it matters how leaders are spoken to, how they're given feedback as well, and how their staff are feeling, and we're trying to help them in their roles. And we've given them resources and lots of different things that you can read the rest of the slide. But basically what we're learning is we've involved 1,000 staff so far, so we're really understanding about what some of the biggest issues in our organisation are from a theme point of view, but the magic happens on the teams and in the wards and in the areas where you listen to what matters to them and you just get on and you do it. So this is our what matters to you staff cycle. I need to publish this because I know it's being used in other places now, but you identify your area. It's an 8-point thing. You assess whether a team is ready. Are they ready to, as a team, to really listen and understand what matters, to ask, listen and do what matters, not just do the asking, not just do a survey, or not just do a questionnaire, or not just have an open morning, but are you really ready to listen and do what matters? So and some teams we don't start working with, we delay until we feel they are ready. Then we have a survey which is around our site priorities. It's very short, takes 2 minutes to fill in. We then analyse the data, which is the bug of my life, but it's a really important thing to do. And then we report to the senior team what we're doing, and what they've said and what their teams have said. And the first time I did this, I made the team cry. So I learnt very quickly and rapidly about how important it is to feed back really carefully to senior leaders and leaders of the teams about how their staff are feeling, and do that in a kind way. Really kind, and really supportive, and thinking about how we can share information that can be used for improvement. Then the magic happens when you feedback and discuss with the whole team. We all know when you're if you went for a counselling session, you know, the person in front of you will reflect what you've said, and that's very, very powerful. But we don't do that really in healthcare with staff at all, and it's very, very powerful. We go around, we're working with 40 teams at the moment, and we go and we sit with them, we tell them what they said, and then we layer on more information about how they're feeling and what action needs to happen. And then the teams make an action plan, and then we make sure that staff wellbeing is on the agenda. And it's my organisation has got lots of you know, there's ups and downs in every organisation, but we are now feeding back all these action plans from all the divisions, from all the 40 teams into some of our most important meetings for the execs to see, so that staff wellbeing is really on the agenda. And then we resurvey. We've only resurveyed 2 teams, and they've both had really massive improvements, which is just really exciting. But that's because they've got amazing leaders in those organisations. You just need a bit of help to find out what really mattered to their staff. So, you know, these things are really, really important. And if you're going to embark on the What Matters to You journey, you need these things, particularly when at this time when staff are struggling and when waiting lists are really long and when people are feeling burnt out. As you know, as leaders, you really need to have courage to ask the question. You really need to be curious. It's not just someone saying, oh yeah, you ask them what matters, oh, that I get home on time. Well, why does that matter? And why is that not happening? And having curiosity to have those deeper conversations, and then a consistent commitment to do. So that's what we talk about in our organisation, having those things. This is some of the things that we're hearing. As I say, really useful for the organisation to know, but actually to staff on the ground, we really just have to make sure that we keep the action plans in really specifically for the teams, so that they feel they can do something about it. So the further you come away from a What Matters to You conversation, the more like sort of physical distance you put from it. Yes, it can be useful, but it's not as useful. You want to be as close to the conversation as you possibly can be. Anyway, here's some pictures of some of our teams that we've worked with over the time. And I'm just conscious of time, and I'm not rattling through this. And there is something about, yeah, just like really, really involving staff in being in ideas. They know what matters to them, and they can often see what can be done and what can be improved. I'm going to skip a couple of slides, I think, here, because we don't need to see all those. But some of the things that we're seeing is about staff they need leaders to take away the things that are blocking them to do what matters most. People come to work to try and do a really good job generally, and there's a lot of distractions. And what can people do to take away some of the things that inhibit that, helping to make it easier for staff to do the right thing. One of the biggest things that we've heard is that people feel there's a constant change around them all the time. Maybe it's just our organisation, it might not be other places, but people don't feel involved in the decision making. We hear time and time again, you can't communicate enough. Please talk to us, please involve us, please listen to us, and put structures in place so that can happen. Don't just ad hoc meetings. Let's organise and put structures in place so that you can hear from us, tell us, and listen to us. Another big thing is about safety and about people really want an environment where they're safe to speak up. And some places that feel really happy, and some places not so. So psychological safety is really important. They really want to see their leaders. They want them to be visible and present. And they obviously, as you can guess, what matters, providing resources and training for their roles, particularly at the moment with cost of living crisis. There's a lot of sense that people want to progress, partly from a financial point of view as well, and they also want their teams to be celebrated. So that's really important. And I would say, as I say, we've probably had, I don't know, I must have 6,000 quotes from staff, and all these things that really matter to staff. And if I was to try and match my 40 quotes, or my 6,000 quotes with my 40 teams, I wouldn't be able to do it, because you can't guess what matters to certain people in certain areas. You might have a hunch, but you don't really know. So it's really, really important to ask. I'm just going to end with a slide from yesterday. So I organised a staff wellbeing day because I spoke to a couple of nurses, and I wanted to talk more about this programme and about the learning we're having in the organisation. And I spoke to a couple of matrons and said, what do you think? What matters to you? And they say, Carol, we don't want that. We want a staff wellbeing day. So I'm like, oh my goodness, I need to follow my own mantra, ask, listen, do. So we did it yesterday, and we had 30 teams from who came and supported staff, so from psychological support to physical exercise to the wellbeing offers to, you can see a bit of chair yoga. That lady there doing the chair yoga is actually our operations director, and she did chair yoga for staff. And what we realized, what she thought would matter, is having a session on a Tuesday afternoon in the chapel. And what she found out when she spoke to staff, and quite a lot of lots of staff who wouldn't normally access yoga, what mattered to them is that it was on a chair and not on the floor, because they find it hard to get onto the floor. And what mattered to them, that it was done in their lunchtime, because the hours they work they don't work regular hours. And what mattered to them is that she went to them. So she's going to set up a group for the domestic team at lunchtime and sitting on a chair, which is not what she thought mattered, but when you ask the question, you find out. We offered lots of advice about debt and cost of living crisis, along with lots of other things. We've got a clothes swap where so people come and bring their clothes they don't need, and staff can come and take clothes, and we have people picking up coats who can't afford coats. I mean, it was quite sobering. So there are lots of different things that matter. So we set up a day with lots of something for everybody. And that was that was yesterday. So I'm going to stop sharing my screen. I'm going to stop talking. But that is just a whistle stop tour really about some of the work that we're doing for staff, and the importance of the question, the what matters to you question for staff. And if you've never asked anyone before, I would ask your colleague you're sitting with what matters to you. And don't, if someone just says, oh, my family, ask a bit more, be curious, find out a bit more about what really matters to them, and have that connection. I know it's really silly, but I ask my kids every Saturday morning, what matters to you about today? And one of them will say, I'm really exhausted, I need but I'm overwhelmed, I've got loads of homework to do. And I'm like, all right, how can we help you with that? And my husband will say, I need to sleep. And I'm like, fine, okay, fine. A cycle and a sleep, whatever. It's like recurring. I can kind of guess what matters to him now on a Saturday. But we kind of start the weekend knowing what matters to us all. And that really is so simple and so easy. And it helps. So I would, have a, and also it's really important to know what matters to yourself, sort of finally, and being kind to yourself and thinking about what really matters in certain situations to you and being connected with that. Because I think once we're kind to ourselves and we understand what matters to us and for our colleagues, we have something to give to the people that we're working with too.
So I hope somebody asks you what matters to you on the weekend as well, Karen, not just you asking your family and things. Questions from the audience, but whilst they're putting their hands up, it struck me around, you have to ask the individual teams. You mentioned you've got 40 teams that you're working with. I'm wondering about, and you mentioned the readiness. How do you know if a team is ready? And also the scalability and transferability of some of the things that come up, because you mentioned the ITU. I mean, that's fabulous retention figures, isn't it? But I wonder, is that whatever you did, is that transferable to another unit?
Yes. So transfer. I'll answer the transferable question. So yes. So we worked out sort of what some of the biggest wins we thought were some of the biggest changes. One thing in ICU, and actually quite a lot of our learning from this program has sort of come from that as well. Like things like just regularly asking what matters. One thing that came up a lot with the ICU team where they wanted more autonomy and choice and control over work and when they came to work. And at the time, I mean, this was 4 years ago, but there was they did a paper like schedule, and there was an online one as well, and they were sort of together. But if you were in work on that day, you had first choice of when you came to work. And we just totally radically changed it, and we did self-rostering, and I'm sure lots of places do that now. But we gave, instead of having people choose, or staff saying, okay, I'm allowed to choose, I think it was 4 initially, 4 shifts a month. It went up to 6 and then 8, and then just people could choose as many as they wanted to. And actually what was really amazing was that then the matrons were like, this is making my life easy within sort of certain controls. like guidance. You have to work a certain number, obviously, per month, but people were filling in their own roster. And actually, I was with the ICU team last week feeding back their current What Matters to You stuff, and they still, the stuff they talk about of being what's really good at working there is lots of the stuff we did. And so we trialed it in ICU, and yet then it spread across the whole organisation, so everyone does that now. So there is, yeah, definite learning, and also just celebrating, because if you celebrate and share with teams, they pick up other things. There's some stuff like we've heard in quite a lot of teams about some quite sensitive things. So when we did this work in our theatres team, we heard that people were saying there's lots of different languages that are being spoken, and people said that was very excluding. And it was someone who said, look, English isn't my first language, and yet I think there's 30 languages that are spoken in theatres. It's a really big department, about 400 people, and so, but I don't know what the answer is to that. So you go and you speak to staff and say, what is the answer? What do you want? This is what you've said. This is what you've said. It's not the exec saying everyone must speak English all the time. It's you saying to staff, this is what you've told us. And so the decision was made that everyone will speak English in clinical areas, and on their break time, they don't have to speak English. But that's something that has then come up in other areas. It's come up in endoscopy and then on one of the wards, and you go, we've come across this in theatres. This is what theatres have said. But what matters to you in your department and your ward? And actually, endoscopy have decided they want to speak English all the time, even on breaks, because they think it's excluding even on break time, whereas theatres have done something a bit different. But it's much easier to say, this is what they said that, and this is what they're doing, not this is what we are telling you to do. So there's definite learning, definite themes. I'm actually meeting with my my director of nursing next week, who's my boss, to go through and think about some things. So things like exec visibility and walkarounds. So there's certain things that have come up in lots of surveys that they need to do, they need to organise. And then how do you tell a team is ready? You meet with them, you just say, you ready? Or what happens is they don't meet with you. So someone might say, well, I won't say which team it was because that was unfair, but I've had someone say, Karen, you need to work with this team, and they won't turn up. And then so you don't carry on, you just say, okay, well, we're not, when you're ready, you contact me. And that's what I do. I've got enough teams to work with. And so the whole premise of this works on pull, not push. So at the beginning we had to do a little bit of pushing because we had to say who wants to test it. But now it's pull. I've got a list of people who've seen it work in their other areas and want to do it in their certain teams, and so it's total pull now. Yeah.
Thank you. Thank you.
But you have to be brave and say you don't have to do, there's no pressure from me to do it. You have to want to do it. I'm not enforcing it.
Lorraine's got a question, and then I'll come back to you, Jemima.
Hi, Karen. Yeah, I was just really interested in that presentation and the common themes that would appear to affect us all, particularly slide 9 in the pyramid that you showed there, and lots of the things that we're looking at. Obviously, you see that in the National Staff Survey. But do you think, what you described is wonderful, and in our organisation we really like to focus on health and well-being of our staff, but do you think that's dependent upon the culture of the organisation in terms of what you described as blockers, not only blockers with the staff themselves, but it only really works, doesn't it, if you've got a manager who's got emotional intelligence and is happy to be challenged and has got the courage to see what matters to the staff is not a threat to them, but actually listening and hearing what they're saying. That's difficult if you've not got a manager or an organisation that supports that, isn't it? Do you think?
I totally agree. And I one thing I have learnt doing this work, is that we have what they call micro systems within this whole organisation, and so but you might have it's not consistent. You can't say like there's no sort of one sort of culture. I don't think within a large organisation there's lots of different. It's made up of lots of different bits. So I would I would say you definitely need exec support or someone sort of senior support. But I would say in any organisation there has got to be those bright spots where people would want to do this work. And yes, you are going to have those very difficult areas. And what you're hoping is that you start with the pull where people would happy for you to go. And then it's a success. I saw someone like, no one really wanted to do it at the beginning. Not really. I had one like friend, because I used to work with, don't know if anyone knows Rupinder Gilmore, she's just amazing. She's an oncologist, oncology consultant. And I worked with her when I was a physio. So I basically said, Rupinder, will you help me out? Can we do it on my old ward? And then she did it. And then she was sitting on the train with her friend, who's also a consultant but works in cardiology. And Rupinder was saying, you've got to do this. It's really cool. It's hard to hear that it's really useful. So I have the cardiology consultant say, oh, can we do it in our ward? And you realise hospitals, they're not there. Yes, we have structures and divisions, but it's all about relationships, isn't it? It's all about who you know, who's connected, who thinks this is a good idea. And we have I think for staff wellbeing, we have to think our communication networks and be using them.
I think you're absolutely right. It's all about relationships, always, isn't it? Always. Has anybody got any other questions? I'll speak to Jemima whilst you're thinking. I was quite surprised at the menopause figures, actually. Didn't realise that was quite as high in young people. And lovely that you've got that group going on, and also the mental health. And I wondered if those levels of mental health issues are consistent with young people who don't have cancer, because it's a big deal at the moment, isn't it? In terms of it's a big focus. And my other question was around it's just gone out of my head. Start with that one, and I'll come back to the rest.
Okay, so in terms of, very interestingly, that people obviously 20s and 30s are struggling with mental health anyway, particularly because of what's happened with COVID, but 20s and 30s have the highest incident of anxiety and depression out of cancer patients if you look at the quality of life survey. But what we do know is there are so many things that help with mental health. So I think it's about reframing it. So with the holistic needs assessment, you have the I'm a nurse by background, but I haven't looked at it for a long time. But the barometer of stress, isn't it? A distress barometer. Is that right, Elaine?
Thermometer.
Yeah. Thermometer. Sorry, not a barometer. That's weather. And it's about, yes, if you're hitting 3, 4, or whatever it is, that is so much that can be done at the level before it hits here. And a lot of young people are saying they want to be forewarned. So they're forearmed. So it's about when those conversations are happening. When do we start saying that actually post-treatment is harder than the treatment itself? When do we start dropping in that exercise is a good thing to do? Because a lot of people aren't receptive during treatment. A lot of people just want to get their head down and continue, which is what we hear all the time and again. But there might be those teachable moments. And I think it's about reframing. In terms of the menopause, I'm going to be totally honest, the 40% comes from everyone. So everyone who, not young people. There aren't stats. That's the other thing. There's not enough. I've spoken to Louise Soanes and I said, what percentage do young people get early menopause? She's like, oh, it's not collected. Yeah. So the other thing is it's not on holistic needs assessments. It's not on treatment plans. And a lot of people are saying that they may be told at the beginning of treatment that they might be infertile, they might go through early menopause, but it's not being revisited. So, I mean, that's just key, isn't it? The post-treatment holistic needs assessments aren't always done post-treatment. And actually, people are more receptive to understand what they can do and feel empowered and what matters to them, Karen. And, how can they move? They've got many years to live. And, it's the quality of those years. And I know there aren't post-treatment clinics and late effects clinics, but you have to hit a certain criteria to go to those. So it is about self-management. It's about using those teachable moments. it's about every contact matters. So every person who comes into contact with someone who's gone through cancer has an opportunity to check in on that person's mental health. Have you given that a go? Oh, I spoke to another patient that's like this, or you guys do an amazing job. It's just those little moments that could be used. It's not all mental health support should go on a clinical nurse specialist. What about a radiographer who's just having a chat every day for 6 weeks? What about you know, we've got cancer patient navigators. Why not train them up in level 2? You know, I just think there's some really key things that could be done, because it should not all people need to be referred to a psychologist. It's about the confidence to be able to have those conversations. And what Karen says is absolutely key. It's communication. And Karen, I just want to say, we met years ago and you changed my life when you introduced me to the What Matters. We met because you made me think about it for young people so much more, about, you know, how do we address those, exactly that, and how do we know we're actually making an impact? Because what's the point of doing something if you're not actually revisiting how it's had an impact on people? Yeah.
My
So
other question came to my head, was a practice issue actually. So I don't come across many young people, but I do occasionally. And I had an incident last week with a young guy who was on the telephone, and he has a terrible cancer, but he's doing very, very well. But I hardly got to speak to him because the mother was there, and she was very supportive, very engaged, very lovely, lovely family. But this is on the telephone as well, which adds a barrier. And you know, I could tell from my assessment that exercise wasn't an issue. He was really keen. He's a footballer and he was doing all sorts of things. But I did get a couple of cues that I wanted to probe a bit more, which is difficult on the phone as well. And I don't know him very well. But I couldn't do it. Just couldn't do it. And just, you know, what's the tips for finding that teachable moment, if you like, or finding that because the mother was so dominant, and
yes,
you know, I don't want to embarrass him or her, but equally not leave something unsaid. So
I suppose what I would say is that you can give that opportunity to say, I really want to talk to, you know, your son without you there. But also at the same time, I think it's it's so difficult, isn't it? Karen, you might be a better one in terms of bringing up those teachable moments. I suppose if you don't ask, then you haven't given them the opportunity to talk about it. And if they don't want to talk about it, so lots of people are saying that they're too embarrassed to talk about sex, and then the healthcare professional is too embarrassed to talk about sex. So actually there's a kind of stalemate going on. So one of them has to be brave enough to bring it up, and it shouldn't be on the patient.
the patient, no, yeah.
But with that moment, Elaine, I feel your pain, like, you know, but I think what I would say is there's a lot of emphasis on the physical impact of not being able to have sex, or not, but actually it's that sense of, I don't recognize my body, I don't even know how to have pleasure myself anymore, let alone. And, you know, dating, like, how do you have a conversation with someone? What matters to lots of young people is being able to hit those things that are what young people are about. And it is embarrassing, but I think we need to take life by the balls.
Yeah. Lorraine's got a comment, and then we'll wrap up.
Yeah, I was just following on from Elaine's point there about difficult conversations. For us working in a medical day unit in a busy chemotherapy unit, of course you're trying to do a comprehensive assessment, but the time challenges and the fact that people are around you, and we've got a male nurse on the unit who built up really close relationship with a female patient who was going through breast cancer, and she, because of his age, the same as Harry, she just opened up about all of her sexual issues and her sexual activity and everything. And he was really good with her and managed her, but everybody else that was around in the room, then they were picking up on the conversation. So, you know, that it's multifactorial, but it's a real challenge for healthcare professionals, I think, to really drill down and have those intimate, challenging conversations. Yeah.
I also think there is cultural stuff as well. I think, you know, I think it's really important. Like, we talk about on the menopause program, we talk about masturbation, we talk about pleasure, but you also need to be aware of who you're talking to right in front of you, and also what people are saying most probably is different to that. So if they have their partner in the room, then they could be saying one thing, and actually the truth is something else. So I think sex is something that we are looking at. We've done a lifting the lid on sex, which is on our YouTube channel, but something I think is what I want to do is looking at how we bring those conversations up in a way that is not uncomfortable for staff and not uncomfortable for the patient. But because maybe sex doesn't matter, talking about what matters, you know, maybe sex isn't what matters to that person, and you bring it up and it's like, actually I care more about the fact I want to go to work, like, you know, that what matters. Yeah, I think the what matters conversation is utterly key, because but then that person might be too embarrassed to say, actually sex really matters to my life.
Do you want to come in, Karen?
Yeah, just to say, I totally agree. I think it's a really interesting discussions. I wish we could carry on.
Yeah, me too.
I think actually, even if you bring it up and it's embarrassing and it's even not right, like even if they go, oh no, they've been given the permission.
Yeah.
And it might not happen all in that moment. All I'd say is everything doesn't have to happen in that one moment. You just plant the seeds, and they'll register it. A healthcare professional is prepared to talk to me about these things. Oh, I'm too embarrassed to talk about it now. But maybe they will next time or the time after. Or maybe you say to them, I really want to know what matters to you. Next time you come, I'm going to ask you about sort of, you know, sex or menopause or whatever it is, just so you can give people preparation time, and then we're not assaulting them as well. They feel assaulted, because I think sometimes we're worried about assaulting people, but generally it will open it up and give them permission, and that is so vitally important. And Jemima, I think you're doing amazing work.
Oh, you're very welcome, and thank you both for your thoughts. There's a comment in the chat. There's a challenge as well for clinicians to feel able to support or know where to get the support to act when we ask these questions. So that's a health service issue, isn't it, that we need to address. Thank you both so much for coming today. I know Jemima's quite happy for people to contact her, and we'll send you some cards and come and visit your departments and things like that if you want to understand more about what they do and what the opportunities are for young people. And Karen, I think that the document that you said, the Joy in Work, was it called?
The Joy in Work. Really worth the read. And there's quite a lot of interest in the staff wellbeing.
Thank you all for your time and for the audience, and I'll put the certificate in the chat as soon as my paperclip comes up. And thank you, and have a great afternoon.
Take care. You too. Take care.
Bye.
Bye.
Thank you. Bye.